quite frankly, I don't think I would be alive right now if I had not gotten treatment. It just consumed every minute. And so to be free of that and know that it's possible, that keeps me going.
What are leading emotional barriers holding clients back from entering treatment?
I would say the top two that I've experienced in my roles working with eating disorder clients is fear is probably the top one, fear of the unknown. Eating disorder is so familiar to me, but I don't know what recovery might look like. And apathy, there just gets to a point where the eating disorder voice has become so loud and controlled every aspect of your life that you almost don't care, You might have loved ones telling you need treatment, partners, but it's like, I don't really want to give up my eating disorder yet.
What are common misconceptions about eating disorder treatment?
One common one that we hear a lot is I'm not sick enough to need that much treatment, whether that's, day treatment or residential level of care. So we do a lot of education on the front and work at building trust to help the client understand you are worthy of treatment at this level of care. Another one is that the treatment team is going to have completely different goals than me. Their main goal is to change my body size and shape. And that's just simply not true. We prioritize creating a safe, warm environment for the client, getting to know them and what their goals are. They're every step of the way collaborating with us on their goals, and we check in weekly. Clients come into their treatment team, they're able to say, hey, I need more of this, or this isn't working, and we pivot and adjust.
What are people not talking about?
I don't think people talk about the incongruence an individual faces when they're being told they need treatment, they're being told, you're getting worse and worse in your eating disorder, and at the same time, all of the cultural messages are get thinner, go on this diet. There's this ideal that we have of what our body size and shape should look like, and it's completely incongruent from what we're saying of, having your authentic self uncoupled from the eating disorder.
What are some realizations that have helped clients overcome their fear or resistance to treatment? And where's the breaking point for most people?
I think the further that individuals get in their eating disorder and start to see the impact on relationships, kind of the feedback they're getting from their loved ones, that can help start to sway things. But I always like to tell clients, you can go back to this, I don't want you to, I hope you don't. I think you're going to find recovery to be life-giving and bring you joy, but just give it a try. It doesn't hurt anything. You can try this, but you know how to go back. And I think when you're not putting people in a corner and having them still feel like they have choice, that can be really helpful.
And that's difficult to do, I think, though, when you have this malnourished piece.
Yeah.
And without the body being nourished, the brain isn't online.
Yeah.
And I think at that point, really fear is running the show.
For sure.
So in my experience, when I think about the breaking point, unfortunately, I feel like it's often when you've hit some sort of medical instability, or you've had some sort of medical event that for the first time might be a little bit scarier than the idea of giving up your eating disorder.
Yeah, it's true. I mean, by the time we see folks at the higher levels of care, it's usually gotten pretty bad, for all the reasons you just stated, the medical instability, EKGs are coming back abnormal, labs, all of those pieces can be a piece of that, and that can cause a different fear. So it's kind of weighing out those fears.
I think that might also help loved ones and the ones that are really pushing at first to get someone in treatment to understand the gravity of the disease or of the disorder, and maybe turn up their efforts, and we don't have a choice anymore. And I think people really are stunned when we talk about how serious eating disorders are, because they fall in the mental health disorder category. Yeah. They are unique in that they have that medical component to them. And I mean, we know in this field that eating disorders have the second highest rate of mortality of all mental health disorders, just second behind the opioid use disorder. And that a person, this is the one I think really gets people, that a person dies from an eating disorder every 52 minutes.
Yeah.
And
that's just the ones we know of.
That's just
right?
the ones or have been attributed, the cause of death has been attributed to the eating disorder.
Yeah.
Yeah.
And it takes a village, because it takes a long time usually for someone to kind of raise the white flag and say, I surrender, I'm ready for treatment. It often takes loved ones coming alongside, maybe outpatient teams. That's why I love having clients just come and have a conversation with me or the therapist, take a tour, because it really takes all of us kind of linking arms and coming around that person to get them to the next step.
Mm-hmm. Building that trust that they're not going to have to do this alone.
Yeah.
What's your why?
It's a big one. That's why I'm here today. It's why I am so passionate about the care that we provide. Almost 25 years ago, I went to residential treatment myself after being hospitalized, and I now have the perspective of what life is when I'm not controlled by my eating disorder. And quite frankly, I don't think I would be alive right now if I had not gotten treatment. I was even told I wouldn't be able to have children because I had done so much damage with my eating disorder, and I now have 4 healthy kids. The joy and the peace that I have when my mind isn't controlled by thoughts of calories and what am I eating next and when can I exercise and how can I, burn whatever I just ate. It just consumed every minute. And so to be free of that and know that it's possible, that keeps me going. I love to be able to share that hope when a client isn't there yet, when they think there is no possible way that I could live a life where I'm not obsessing about everything going into my mouth. And I'm like, no, you can. It's possible. And let me tell you more. I think it's so important that those of us that have found recovery talk more about it, because it can feel so hopeless when you're in the midst of it.
What truths do you tell people when emotional barriers are keeping them from treatment?
I actually like to be curious and just ask some open-ended questions, like, tell me what brings you joy right now. And that really stumps people, because it's like, the further you get in your eating disorder, there's not really like a deep-seated joy anymore. There's isolation, there's obsession, but there's not joy. And that usually opens the door for a conversation of, what do you actually value? Like, what does your authentic self value? A famous line that I hear a lot around here and in our programs is, your eating disorder was hard, recovery is hard, choose your hard.
How about parents? What truths do you tell them when they're hesitant to send their child to treatment?
Yeah, I think there's a lot going on in a parent's mind. As a mom myself, I get it. I think I first say, like, this isn't your fault. I think parents can also feel a lot of shame and kind of go back of like, what did we do wrong? What could we have done differently to prevent this? And it's so important that they know this is a complex disorder, and there's multiple factors, but it's not their fault, is a big one. I think helping the parent to understand they can still be involved in the child's treatment is important. Of course, if the client's an adult, that might look a little different, but at all of our facilities, we offer family sessions, education sessions, visitation. So we let the families know, like, we want you to be involved. Like, it does take a village, and it's important, if the client's okay with it, that you're involved.
Thank you, Amber, so much. I appreciate all your openness to these questions and you sharing all of your experience and expertise with us.
Absolutely. And we're always here if potential clients or families have questions. We love to connect in that way and just help come alongside you as your village.